The webpage titled Lyme Disease Quick Facts infographic by Daniel Cameron says, each year there are 300,000 new cases. Each week there are 5,770 new cases. And each day there are 822 new cases. As you can see, Lyme disease is a growing and alarming problem, and it affects many people throughout the United States. My main goal in this speech is to inform everyone about Lyme disease, and this will include the history and background of it, the symptoms, and the treatment that you must undergo. To begin this speech, I believe that it is important to tell you about the history and background of it, that way you have a better understanding. The webpage titled Bay Area Lyme Foundation in its article called History of Lyme says that Lyme disease was discovered in the 60s and 70s in Lyme, Connecticut, hence how it gets the name Lyme disease. The disease was not actually classified until 1981. Although this is when it was discovered in the United States, it has actually been around for much longer. The article goes on to additionally say that the bacterium that causes Lyme disease was found in an autopsy of a mummy that was 5,300 years old. Lyme disease is mostly found in the northeastern, the mid-Atlantic, and the north-central United States. And Lyme disease occurs when you're bit by a black-legged tick, or better known as a deer tick. According to the Centers for Disease Control and Prevention, the CDC, its article says the article called Lyme disease says that Lyme disease is caused by the bacterium Borrelia burgdorferi and Borrelia mayani. Additionally, an article I read from the RBC Library called International Journal of Dermatology says that it is an anthropozoonose which manifests itself as a multi-system disorder of the skin and other organs, and the other organs include the joints, the nerves, the heart, and eyes. The next thing I would like to talk about in this speech is the symptoms that you experience when you are affected by Lyme disease. The article Lyme disease on Mayo Clinic says, when you notice that there is a small circular rash on your body that is red and appears as a bullseye, this is an early sign of Lyme disease. Some other common signs of Lyme disease may include fatigue, fever, chills, body aches, and swollen lymph nodes. The article goes on to additionally say that you experience erythema migrans, joint pain, and neurological problems. As stated in the article from the CDC, Signs and Symptoms of Untreated Lyme Disease, it says that erythema migrans is a rash that occurs in about 70 to 80% of infected people, which is a large percentage, and over time it can expand and reach up to 12 inches in length. Additionally, there are some other later symptoms that can be experienced. One of the symptoms is facial palsy, and what facial palsy is, it was when part of your face is paralyzed, which causes part of the face to droop. Some other symptoms include severe arthritis, nerve pain, and irregular heartbeat. For Lyme disease, it is called Lyme carditis, and severe headaches. The last thing I would like to touch on is the treatment that you must undergo. If you experience any signs or symptoms of Lyme disease, it is very important to go get tested. In the article Lyme Disease Test on the website lymedisease.org, it says that the most common Lyme disease tests are indirect ones. They measure the patient's antibodies response to the infection, and they don't measure the infection itself. The two most used antibody tests are the enzyme-linked immunosorbent assay, which is also known as the ELISA, or the Western blot. Currently, Lyme disease has no cure, and I know they're looking for one. However, there's treatment that you can undergo that can help lessen your symptoms, and treatment can look different for everyone, especially because Lyme disease can vary. According to a webpage, lymedisease.org, in its article called Lyme Disease Treatment, an early treatment for Lyme, they will put you on a strong antibiotic, and they may also treat you for the rash for the tick bite. Additionally, you may be on treatment for the rash longer than usual, because it is important to make sure that the disease is not progressing, and you want to make sure you get rid of it. If you are discovered that you have Lyme years later, or the early treatment was not very successful, treatment can look very different. According to Lyme disease symptoms on the webpage Healthline, it says that post-Lyme disease occurs when you still continue to experience symptoms even after taking a strong antibiotic. Additionally, an article I found on RBC Library written by T. Joseph Mattingly II and Kalpana Sher-Wolf named Clinical and Economic Outcomes Evaluated in Lyme Disease, a Systematic Overview says, While antibiotic treatment of early Lyme disease may improve the cutaneous symptoms and prevent other early disease complications, there are still 10 to 15% of patients that will develop a late-stage disease called post-Lyme disease or late Lyme disease. In this speech, I have talked about the history and background of Lyme disease, the symptoms that you experience, and the treatment that you must undergo. The reason I chose this as my topic to inform is because my dad was diagnosed with Lyme disease about 5 years ago, so that would have made it 2015. He has experienced some major symptoms and knew something was wrong, so he decided to go get a diagnostics test. When the test came back, it came back as positive for Lyme disease. Due to not experiencing any early signs or symptoms of Lyme disease, they believe he's had it for many years. After he came back as positive, he started treatment, and this started with a strong antibiotic, and at the beginning it was not very successful, so he had to continue to do treatment, and he developed post-Lyme disease. However, now he is much better, and he experiences no to or mild symptoms.